Hello people, Namaste, welcome back to my channel. In this video, I will discuss about the acquired cataract continuation. In acquired cataract, the senile cataract. I will discuss about the senile cataract. The most common cataract in acquired cataract. Okay. First of all, we should discuss the what is senile cataract. Age-related cataract is called as senile cataract. It is the most common type of acquired cataract, affecting both equally male and female, which are above 50 years of age. Above 50 years of age only, this senile cataract can be seen in that both male or female. What is the morphological types? Generally, there are three types of cataracts: cortical, nuclear, and posterior subcapsular cataract. Wait a minute. It is very common to find nuclear or cortical senile cataract coexisting in one eye. So there I discussed the three types of cataract, like cortical cataract, see, nuclear cataract, wait a minute, nuclear cataract is posterior subcapsular cataract. So one eye we can see two types of cataract, like in one eye we can see both cortical cataract and nuclear cataract also. So they are discussing the coexisting in the eyes. Two types of cataracts can be present in the same eye. So next we should discuss about the etiology. Senile means age related. Etiology is age. First one is age related. Okay, age related diseases and sex, both common in male and female. Hereditary is the most common risk factor in cataract. Because of hereditary, the cataract will come to the persons, and because of UV radiations also. UV radiation is important. Because of dietary factors deficiency like vitamin A, C, E, and what is that, riboflavin also. Next, dehydration crisis. Crisis means dehydration crisis because of any diarrhea or any cholera in childhood. It leads to maturation of cataract in some persons. Smoking will leads to cataract. See, in smoking, why smoking has frequently leads to nuclear cataract. I discussed about three cataract now: nuclear, cortical, posterior subcapsular. In nuclear cataract, the most common risk factor is smoking. Why? Because this is because deposition of pigments like 3-hydroxy kynuria and chromophobes, which leads to yellowing. Nuclear sclerosis have some pigments, so we can. And next, pigments deposition. Cyanides are present in smoke that causes carbamylation and protein denaturation. Generally, cataract occurs because of carbamylation, important one, carbamylation and protein denaturation. So we should know the risk factors. What is the risk factors? Like age, sex, hereditary, UV radiations, dietary, dehydration crisis, and the smoking. Next, to causes of pre-senile cataract. Some persons having less than 45 years, they are having cataract. Why they are having cataract? Because of hereditary. If the family has any cataract, it leads to more senile, less than 45 persons having cataract will common. Hereditary. Next one are important, like diabetes mellitus. A person having diabetes mellitus is leads to cataract. I discussed in previous video, the cataract is called snowflake cataract. Next, myotonic dystrophy. Because of myotonic in the muscle related diseases, this leads to cataract. This is a Christmas tree cataract. Next, atopic dermatitis. Because of skin related diseases, it leads to cataract. It is called shield cataract. Okay, shield cataract. These are the causes of pre-senile cataract. Next, we should discuss about the mechanism of loss of transparency. Why there is loss of transparency? See, there are two types of cataract, like nuclear cataract, senile cataract. See, cortical senile cataract. Next, nuclear senile cataract. First, cortical cataract. The outside layer is called cortical. Next, nuclear. Cortical. Why the cortical occur? What type of cataract present in cortical? What is the mechanism of cortical cataract? Cortical cataract is because of hydration of the lens. Because of more hydration of the lens, it leads to opacification. So then it will be softest of the lens will occur. So it is the cortical cataract. But in nuclear cataract, it is due to sclerosis of the lens. It is due to sclerosis of the lens. It is a hard cataract. See, I will read. Cortical senile cataract is a main biochemical features are decreased levels of crystalline lens of protein. Protein levels are decreased, amino acids decreased, potassium levels associated with increased concentration of sodium and hydration of the lens are increased sodium and hydration of the lens, followed by coagulation of lens proteins. All these can occur here. Here increase of hydration and sodium sodium only, decrease of amino acids, proteins, potassium, all these are decreased. So it is the softest lens. Nuclear senile cataract is a degenerative process because of age related nuclear sclerosis with dehydration. Here hydration, here sclerosis with dehydration and compaction of nucleus resulting in hard cataract will occur. It is a hard cataract. It is accompanied by significant increase in, why it is because of increased insoluble proteins. However, total protein content and distribution of cations remain normal. See, here not associated with deposition of pigment, chromatin, melanin. Here amino acids, all these are increased, but here no amino acids is increased. Because of amino acid there is a pigment called urochrome and melanin. No deposition will occur in nuclear cataract. It is only because of sclerosis, and cortical cataract only because of hydration. Next we should discuss about the stages of maturation. What are the stages of maturation? Stages of maturation are very, very important. Before stages of maturation, we can deal with the cortical senile cataract. See, with increasing age, there is a decrease the functional activity of Na plus K plus 1. Because of Na plus K plus reversal leads to hydration of lens, and aquaporous mutational cycle leads to maturation of stages of maturation. Stages of maturation, first one is lamella stage of incipient and immature, mature and hypermature. All these are present in stages of maturation. First, stages of lamellar separation. This is the earliest sign. First sign comes under cortical senile cataract. First stage is lamellar separation. Lamellar separations, generally these lamella are present at the cortex. Cortex is made up of lens fibers. Lens fibers. So these lens fibers are generally having lamella, but these because of the lamella, why the lamella undergoes separation? Because there is a vacuoles and water cleft in the anterior and post cortex. These cortex have water cleft present in these fibers. Between these fibers, it leads to separation of lamellae. See, this leads to demarcation of cortical fibers, undergoes demarcation and owing to the separation by the fluid. Because of the fluid, they undergo separation. So we can see the lamellar separation. Where we can see separation can be demonstrated by slit lamp examination. We can see, and it is reversible also. It is the reversible stage. This is the reversible stage. Next, reversible stage, slit lamp examination. Okay, because of fluid, formation of vacuoles and water cleft in the anterior posterior chamber. Cortex, sorry, not chamber. Next, stages of incipient cataract. What is incipient cataract? Incipient cataract has two types of stages. In this stage, early detectable opacities with clear area between them are seen. Two distinct scenes of senile cataracts, senile cortical cataracts can be recognized at this stage. Incipient cataract has what is that? Opacities. Opacities are two different sites are present. There are two types like cortical cataract, and the type is posterior subcapsular cataract. Posterior subcapsular cataract is also called cupliform cataract, whereas this is called cuneiform cataract. What is the cuneiform and what is the cupliform? See, this cuneiform is wedge-shaped opacities. See, these are the, in this diagram they given easily. See, these are the wedge-shaped opacities, which are present at the periphery of the lens. At the lens periphery, they are present. So, this is the important one in this cupliform. Okay, next this is the cuneiform posterior subcapsular opacity at the center. They are seen as a saucer shaped opacity. These are appears as saucer shape, these are appears as wedge shaped. These are present at the periphery of the lens, these are present at the center of the lens. Okay, these are present on the center of the lens. So this is the difference between them. Wait a minute. When the cuneiform, there is an late visual disturbances will be present. These are early visual disturbances and seen in posterior subcapsular cataract. Okay, wait a minute. There is one important topic is there because based on this. Okay, see this. See, this is the cornea. This is the between this called pupil. Space is called pupil. This is the pupil and this is the lens. We discussed about the cupliform and cuneiform. Now we discuss about the cuneiform. See, one mechanism is there. Why there is early and why there is a late loss of vision. See, first is cupliform. Cupliform means at the center. We discussed about the center. See, at the center of the lens. Okay, here we draw the center of the lens. When the person enters into the bright light, then pupil undergoes constriction. See, there is no that much of space. Then pupil undergoes constriction. Then light will not enters into this. So they have daylight vision defected. They have daylight vision defected. When same person who having central opacity, when the night vision means pupil undergoes dilatation. Because of dilatation, more space is present. It will not undergo center, but it will undergo at the periphery. The night vision is good. Vision is improved in night vision. The person who comes and tell I can in dim light is vision is very good, but in bright light the vision is not at all good. So this is one of the mechanisms. Same periphery. Wait a minute. This is the cornea. This is the pupil, and this is the periphery of the lens. Okay. At periphery of the lens, this is a cuneiform. Periphery of the lens, there is opacity. When the person will undergoes bright light, he easily, because of constriction of pupil, but there is no opacity at center, the light will easily pass, and vision is good at daylight. At daylight, vision is good. When the person is at night time, the pupil undergoes dilated. The pupil undergoes dilated. Here the light will pass at center, but here periphery the light will not pass. At periphery the light will not pass, and he has night vision is not that much good for this. Not that much visible for the person who are having who are at the night time having the peripheral lens opacity. Okay, so this is the mechanism for why it is late stage, why it is early stage. See, early stage with center, it easily vision will lose very fast than periphery. Periphery you can see here also good, but sometimes it is not good in some conditions only. But here it leads to very early stage of vision defect will be present in cupliform, means subcapsular cataract. Okay, next we can discuss about the immature senile cataract. Immature senile cataract is in this stage opacification is further progress. The cuneiform or cupliform pattern can be recognized till advanced stage of immature senile cataract. When opacity becomes more diffuse and irregular, this lens appears greyish white, but the cortex still present, so iris shadow is visible. So these are the important points in immature cataract. Immature cataract we can see a greyish white color, and along with they have an iris shadow is present. Clear cortex is also present. In some patients at this stage the lens becomes swollen disc due to continued hydration. This condition is called intumescent cataract. This is the important word. What is the intumescent cataract? Cortical means hydration. Because of continuous hydration the lens becomes swollen. It is called intumescent cataract. Intumescent may persist even in next stage of maturation. Due to swollen lens, anterior chamber becomes shallow. Because of lens swallow, the anterior chamber becomes shallow. Swollen, not swallow. When the lens undergoes swollen, the anterior chamber becomes shallow. Okay, this intumescent cataract can be seen in also next stage, like mature senile cataract stage. Also we can see the intumescent cataract. Sometimes in bits they will ask intumescent cataract means because of swollen lens there is a hydration of continued hydration. This condition will occur. Okay, because due to the swollen lens there is an anterior chamber undergoes shallow. Immature senile cataract, in this stage opacification becomes complete. Whole the cortex is involved. Total cortex, here cortex is still present. Clear cortex, here cortex also involved. Okay, cortex is also involved. The lens become pearly white in color, so cataract is called rip cataract, labeled as rip cataract. Ripe cataract, not rip, ripe cataract, sorry. Ripen means pearly white. Total lens involved in opacity. This is ripe cataract. Next we should know about the hypermature cataract. When the mature cataract is left in situ, the stage is called hypermature. When mature undergoes hypermature. This hypermature has two forms. What are the two forms? See, these are the diagram of immature cataracts, grayish white in color. This is the diagram of mature cataract, pearly white in color. Okay. Next, two types of hypermature like Morgagni and sclerotic type. Morgagni hypermature cataract. In some patients after maturity, the whole cortex liquefied and the lens is converted into bag of milky fluid. Here, whole cortex lens, total lens liquefaction, but converted into which color? Milky fluid, bag of milky fluid. The small brownish nucleus settles at the bottom, altering in the position of change in the position of the head. Such cataract is called Morgagni cataract. Sometimes this stage calcium deposit may also seen on the lens of the capsule. Calcium deposits also seen. See here. Bag of milky fluid is present. This is the Morgagni. Bag of milky fluid is present. Whole cortex lens, small brownish nucleus settles at the bottom, alters its position with change in position of the head. Because of this bag of milky fluid, they alter the position of the lens. Because of this alter the position of lens will occur. This is Morgagni hypermature cataract. Next we can discuss about the sclerotic type hypermature cataract. Sometimes after a stage of maturity, the cortex becomes disintegrated and the lens become shrunken due to leakage of water. Lens becomes shrunken because of water leakage. The anterior capsule is wrinkled and thickened due to proliferation of anterior cells, and dense white capsular cataract may be formed in the pupillary area due to the shrinkage of lens. First point, due to the lens shrinkage, because water enters it undergoes shrinkage, and anterior chamber become deep and iris become tremulence, means enlarged. Iridodonosis, enlarged. This is the sclerotic type hypermature cataract. Sclerotic type having three stages: shrinkage of lens, iridodensis means iris become tremulosis, anterior chamber is deep. In previously I discussed about the anterior chamber is shallow in mature and immature also because of intumescent cataract, or these two having, because of these two anterior chamber is shallow, but in sclerotic type hypermature cataract it leads to anterior chamber is deep. Next we should discuss about all these are cortical mature cataracts. Okay, we should discuss about the nuclear senile cataract. Progressive nuclear sclerotic process render that lens elastic and hard. I discussed it previously, like cortical is soft and nucleus is hard. This one only, inelastic and hard, decreases ability to accommodate and obstructs the light rays. These changes begin centrally and spreads throughout the periphery almost of the capsule when become mature. Okay, same. Become mature, it is very thin layer of cortex and remain unaffected. Very thin layer of clear cortex. Clear cortex is present but very thin, but remain unaffected. No affected cortex will not affected. Very thin layer, but it starts from center to periphery. Center starts at the center and goes to the periphery. It is a hard cataract. It is a hard cataract. Okay, it because of sclerosis only. You should remember sclerosis. Next, the nuclear having some grading. Nuclear sclerosis having some grading. Nucleus may become diffusely cloudy. Cloudy is grayish. First step is grayish color. Next tinted yellow to black color due to deposition of pigments. In practice, the commonly observed pigment in nuclear cataract are either amber, brown, or black and reddish. Cataratica rubra, Cataratica nigra, Cataratica brunescensis. Okay, these are the three types of cataract. The nucleus first grading is grayish. Next is yellow to black, yellowish. Next is yellowish. Next pigmentation is Cataratica brown, black, red. Brown means brunescence, nigra and rubra. These are the colors and gradings of nuclear sclerosis. I will see you again. Here, see, it is easy. 1, 2, 3, 4, 5 grade. First one is soft. Generally, this is not present in nuclear cataract. This is whitish and soft, present in cortical cataract. Okay, not this one. From here, grade 1, grade 2, grade 3, grade 4 will be. First one is yellowish, amber, brownish, black. Okay, grayish also present. First grayish, next yellowish. First grayish, not whitish. Grayish, yellowish, amber, brownish, black. These are the grade 5 grades present in the nuclear senile cataract. Next, we should discuss about the clinical features. An opacity of the lens may be present with or without using symptoms. The daily First, there is a glare. The person having cataract, the cataract person having glare. One of the earliest visual disturbances with the cataract is glare. Earliest visual disturbance is cataract is glare. Intolerance to bright light such as direct light or headlight or incoming motor vehicle. The amount of glare dazzle vary with the location or size of opacity, being most common with subscapular and cortical cataract. Most common in cortical cataract and posterior subcapsular cataract, glare is the most common, but in nuclear cataract not that much common. Next, diplopia, double vision. Local diplopia, polyploia, doubling or trebling the objects. It is one of the earliest symptoms. It occurs due to irregular refraction by the lens owing to variable refractory index as a result of catacarous process seen commonly with incipient stage of cortical where there is a spokes cuneiform. In that stage we can easily see the diplopia condition. Colored halos around the light. Colored halos. They may be perceived by some patients owing to break of white light into different spectrum due to irregular refractory index being more common in nuclear cataract. In nuclear cataract we can see the colored halos. Okay, colored halos. But in cortical subscapular, glare is common. Incipient like cuneiform, we can see unilocular diplopia, myopia more common. Colored halos are more common in nuclear cataract. Poor color discrimination is seen especially at the blue end of vision due to progressive yellowing and browning of lens. Black spots of the eye, in front of the eye, all these are present. First one, glare, diplopia, polypia. Colored halos can be seen. Poor color discrimination, black spots in front of the eye. Next, image blur and misty vision. Blur, vision will be blur, occurs in early stage of cataract, especially loss of ability to see objects. I discussed in this no. Bright sunlight, blinded by ongoing headlines at night. I discussed in the mechanism. That is the mechanism. Image blur. Next, deterioration of vision. Vision undergoes decreases. Patients with central opacity, daylight vision, all these I discussed. Patients with nuclear sclerosis, distant vision deterioration due to progressive index myopia. This is the important point. Nuclear sclerosis, there is a progressive index myopia. Nuclear means center. In progressive index myopia will occur. Such patients may be able to read with presbyopic glasses. This improvement of near vision is called second sight. They can read without presbyopic glasses. Generally the patient having nuclear sclerosis can't able to, because of central opacity, can't able to see in daylight or near vision. At some time after some period it undergoes index myopia. In index myopia, the persons can read without using presbyopic glasses. Means he can able to easily see the near vision objects. So it is called second sight. The near vision improvement is called second sight. Okay. So I discussed in patient with peripheral opacity. Peripheral opacity, they can vision improve in bright light and pupil is contracted. Same with central opacity. Early loss of vision because earlier prohibited effect of vision due to its location at the nodal point of the eye. These patients are better when pupil is dilated due to dim light in the evening. Because at the center, the persons can see in dim light. Vision can be improved in dim light. At periphery, the vision can be improved in daylight. This is important in patient nuclear sclerosis undergoes index myopia, and this is the second light of vision, second sight, because the person's improvement in near vision without using presbyopic glasses. And opacification process progresses. Okay, next gradual progressive loss of vision followed by rapid deterioration due to stages of intumescent cataract. Okay. In intumescent cataract, gradually progressive loss of vision is present. Generally, cataract has gradually progressive painless. Gradually progressive painless is present. This is a clinical feature. Gradually progressive painless. Okay. These are the symptoms. What are the symptoms? You should remember the glare. First you should ask the cataract patient. You having any glare? Means inability to see the bright light. Next, you having any diplopia, colored halos are present. Next, any pigmentation in front of the eye. Next, any decrease in vision, means deterioration of vision will be there, and image blur and misty vision can be seen by the cataract patients. Next, In next video, we'll discuss about the science and differential diagnosis and complications and treatment. Thank you. Please subscribe my channel. Please support us. Thank you.